Hi, everyone. I'm Carrie Haverty. I am a member of the NSGC Board of Directors as a director at large. And my day job, I'm a VP of product at Mirvi, and we'll have the great honor of being able to moderate this fabulous discussion between some really interesting genetic counselors who've done amazing things in their careers and have particularly interesting roles right now. And appreciate their time to share their experience and viewpoints on things. And we definitely welcome questions. Please use the Q&A for those. And we'll start with our introduction. So Sandy, do you want to start?
Sure, I do. Hi, everyone. Happy Genetic Counselor Awareness Day. Thank you to the NSGC for inviting me to speak. My name is Sandy McDonough, and I received my degree in genetic counseling from the Mount Sinai School of Medicine in New York City. I've spent over 25 years in diagnostic sales and training, clinical genetics, account management, and research. And I currently work as an associate director for global commercial strategy and precision medicine at Johnson & Johnson Innovative Medicine. I'm excited to talk to you today about my journey into industry. So out of grad school, I worked as a prenatal genetic counselor for a busy MFM practice. And then early on, I transitioned from a prenatal genetic counselor to become a sales specialist at Myriad Genetics. And it was really, I was driven to really impact more patients by increasing the appropriate utilization of genetic testing. Throughout my career, I've witnessed a lot of changes in the delivery of genetic counseling. I've worked at diagnostic companies that were leading how testing was being offered in clinical practice. It's been very exciting to be part of this dynamic field. I've been lucky to contribute to commercial teams and help shape how testing is offered, as well as serve as a clinical resource to healthcare providers, sales teams, internal stakeholders. And this year, I joined Johnson & Johnson to work on our global global commercial strategy organization to support the world strategy and execution of precision, passionate about increasing access to innovative services and cutting edge technologies and therapies that lead to improved outcomes for patients. And I was so excited to find this role. I think it's a great fit for a genetic counselor. I didn't even know before this year that a position like this existed. So it was exciting when I saw that they were looking for someone who had pharma or diagnostic lab commercial experience, who had an advanced degree in genetics, and who had the ability to execute on the commercial precision medicine strategy through projects and deliverables. And I'll talk more about that today, but very happy to join you.
Great. Thanks, Sandy. Sarah?
Yes. Hi, everyone. Happy Genetic Counselor Awareness Day. And also thank you to NSGC for allowing me to talk a little bit about my experience. So my name is Sarah Soto, and I am currently at GeneDx, a genetic testing laboratory that specializes in exome and genome sequencing. And I am head of payer evidence strategy. And so I live in the world of payer coverage policies. And yes, this is by choice. My core responsibilities include educating internal stakeholders on payer coverage, identifying opportunities to expand coverage, as well as reviewing scientific publications and guidelines with a payer lens and pull through for payer messaging and clinical value campaigns. And I began my career as a reproductive genetic counselor. Since then, I've had several industry roles. I've worked at a national payer, a health technology company, and I've also worked at 3 different genetic testing labs. Back to you, Carrie.
Great. Thanks, Sarah. Dawn, you're up.
Hi, I'm Dawn McGee, and I echo the Happy Genetic Counselor Awareness Day, and also NSGC. Thank you for this opportunity to be a panelist. I currently am the Director of Laboratory Genetic Services at LabCorp. So I support all of our laboratory genetic counselors at our 5 genetic laboratory testing sites. But I've had a pretty varied career in terms of roles and responsibilities. I graduated from the Arcadia University DC program, and I have worked as a prenatal counselor. I've worked in research and academia, doing disease-specific counseling for alpha-1 antitrypsin deficiency. I've worked in industry for a biotherapeutic manufacturing company for therapy for alpha-1, and in that role, I was a sales representative. I also was a sales trainer, and so that really gave me a lot of experience in the corporate America side. And then since then, I've joined LabCorp and have really started to develop the leadership skills that are part of the role that I have today.
Right. Thanks, Dawn. Jesse?
Hi, everyone. Thanks again for the opportunity to be here. I'm Jessie Conta. My role, I'm recently joined the market access team at Exact Sciences, where I'm focused on supporting rare disease and hereditary cancer testing strategies. My role is somewhat similar to some of the work that Sarah was just sharing. I started my career in patient-facing roles in both pediatrics and research, and then transitioned to a laboratory genetic counseling role at Seattle Children's Hospital to lead our stewardship program there. And that's where I got the chance to be involved with the inception of the PLUGS program, which is a national stewardship collaboration, and involved in leading a team of genetic counselors, both at Seattle Children's and then this wonderful network of folks in laboratory stewardship around the country, helping patients get access to the right test and get it paid. A few years ago, I started Pick Handle Consulting to focus on identifying and reducing barriers to access for genetic counseling and testing. And that was a unique way to get more integrated with some patient advocacy groups locally. So it's sort of a combination or interesting path, I guess, to get to here, but have all led to experience within the insurance space and understanding medical coverage policies, coding, and administrative workflows to try and make the system work a little better. So thanks again for the opportunity to participate today.
Great. Thanks, Jesse. And again, I'm Carrie Haverty. My current role is VP of Product at Mirvi. We're a startup developing an RNA-based platform for predictive testing during pregnancy and for conditions like preeclampsia and preterm birth. So I'm in a small startup company, different from many of the others here on the call, but also happy to answer questions and address that. I will say up front that all of the conversation that we're having is a reflection of our own opinions and experiences and not necessarily reflective of our employers. And again, please use the Q&A and submit questions as we go along. But we have some discussion set up for folks to dive a little bit deeper on what they touched on during their introductions. So Sandy, I think I'll start with you first. I think Johnson & Johnson Innovation is just super interesting, division or company in a very large organization. So it'd be interesting to hear what genetic counseling skills you feel you use the most in your current role, and were there any skills that were maybe a surprise in how applicable they ultimately were in this environment?
Yeah, that's a great question. Super excited to be part of Johnson & Johnson. And in my current role, I really work a lot partnering with our global and regional teams across the world. So looking at our brand teams, so marketing, medical affairs, market access, and our precision medicine teams. And I help to support on key initiatives that really drive the development and commercialization of our products. I also lead initiatives to help educate internal stakeholders on genetics and diagnostic testing, and I support content development, communication, and events to help educate our teams. So I feel like this is a great job and great fit for a genetic counselor. It really brings a unique blend of skills that we have in terms of clinical genetics knowledge, and also the ability to engage and communicate on a high level with others and contribute to that decision-making structure that exists within the organization. So I think there's a couple of key, for me, I feel like a couple of key skills that I use. So certainly my knowledge around genetics and diagnostic testing, understanding the landscape, understanding who are the key players that are out there offering testing, what is being done in clinical practice, understanding genetic conditions in general, inheritance patterns, how genetic counseling is being offered in practice as well. And it's been exciting for me to learn about that on a global scale. So really having the opportunity to help educate our internal groups. So I mentioned like marketing, medical affairs, market access, who are used to doing pre-launch activities around different therapies, but may not have that deep understanding of genetics and how that plays a role in launching a therapy that would have a potential test to help find patients who be eligible for that therapy. So I feel like the knowledge base is huge. Understanding, best practices for how clinical genetics is offered is also really helpful. Some other things that I find helpful and skills that I've used is that stakeholder engagement. So whether that's helping people I work with directly at Johnson & Johnson or others that I've been working with outside the organization to communicate about some of the projects, initiatives, ways that we can bring therapies to patients. And having those strong interpersonal and communication skills are really key for those collaborative, multidisciplinary discussions. Even outside of the commercial teams that I work with, I talk to people in R&D and business development and regulatory affairs. So there's a lot of communication and having that ability to understand and to be able to explain concepts, to listen, to be able to present things in a more patient-friendly way, especially for an organization that's growing more precision medicine products over time. I think we see that in the industry. So really building that capability within teams. I think just another area that's helpful for me and skills that I think I've honed in on over time also is just understanding how healthcare is delivered, some of the market access challenges, and identifying opportunities for strategic partnerships, whether it's with diagnostic companies, with research organizations, or even other pharma companies, kind of understanding how we can all help to accelerate precision medicine that's being offered globally. So I think having that background in how healthcare is delivered and being able to apply that to a larger setting has been really helpful for me. And I think something that keeps me anchored and motivated is understanding what's best for patients. So I feel like that's something that we develop as genetic counselors. Whether we're clinical or non-clinical roles, really keeping patients at the center of what we do is super valuable in shaping what happens in the delivery of healthcare and being able to leverage the genetic counseling experience to make sure that patients are going to be informed of their options when it comes to testing or treatment, depending on, what the test is for, and whether there's a diagnosis that's going to be delivered. I feel like all of those things are important, and having my experience with patients has certainly helped me to have those conversations at a high level to be able to recognize what would be important for a patient receiving information or for their families to know about eligibility for treatment. I think one of the more surprising for me is thinking about problem solving and also I think being innovative. I think those are things in genetic counseling where we think creatively about how we can talk to patients, how we can help them understand about their own risks for themselves, for family members, understand testing that's available. But I think taking that to the next level in terms of really contributing in discussions, whether it's been here or through my experience at diagnostic companies, and talking about how this patient journey what it looks like, how it's designed, who's going, to be able to access care. I think being able to discuss that, it's not always straightforward. I know we have experts on the line here that talk about market access all the time. So it's not always easy to get people the tests they need. There's a lot of things that have to be put in place. So I think being able to use problem solving, which I think we've done over time as genetic counselors, but apply it in a larger setting. To me, that's been a skill that I'm very happy that I've been able to develop, but I think super important in this kind of role within a large organization. And just being able to address challenges as they come, to be able to think on your feet, to be able to reach out and talk to other colleagues that may help you really to move projects forward. So I really do feel like in my role now, all of these skills have been super helpful for me. And I do think that genetic counselors can really bridge that gap between clinical practice, patient needs, and the business strategy on a team in precision medicine within a large pharmaceutical like where I work today. So I'm happy to take any questions that come up throughout the session, but I will pass it back to you, Carrie.
Right. Thanks, Sandy. It is very exciting to see an expanding number of pharmaceutical companies, joining our industry council and also being in the exhibit hall at the NSGC meeting. I think it's just a great example of our expanding footprint of genetic counselors and the expansive number of roles that we can participate in and help keep that true north of the patient needs first and foremost, like you said, Sandy. So thank you for that. All right, Sarah, so again, talking a little bit about what Sandy talked about, the transition from clinical roles. What motivated your transition from clinic into industry, and any advice for those navigating that transition or considering following that same path?
Sure. So in terms of motivation, I had been working in a reproductive genetics clinic for about 10 years. And I knew I was ready for a new challenge. I knew that I no longer wanted to be in clinical care, but I wasn't exactly sure what I wanted to do. At this time, there weren't that many non-clinical positions. So to be honest, I just started applying to what was available that wouldn't involve me moving and sounded interesting to me. And so I ended up at a startup pre-implantation genetic testing laboratory as their only US employee. And I worked as both a genetic counselor and a business development manager. While this didn't end up being the right fit for me, it did help me transition into other industry roles. And then in terms of navigating the transition, so part of it is just knowing that you are valuable and that you have a lot to offer. That as genetic counselors, we have a lot of great skills that are transferable to the industry. And Sandy actually mentioned a bunch of these already. So things like taking complex problems and situations and boiling them down into simplistic concepts or solutions. Most of us are organized, we're articulate, team player. Sandy definitely highlighted this, skilled in communication, the fact that we're self-sufficient. So I'm sure that as I'm listing these, as Sandy's been talking, you started thinking about others that have come to mind. So now would be actually a good time for you to start building your own personal list. And then in terms of other advice, look for something that excites you, even if it's a little scary and isn't necessarily the perfect fit. So I do think this is true with most jobs, but especially when you're transitioning into industry, just be open-minded. And then maybe the last piece of advice would be developing and maintaining connections. So I admittedly am not great at this, but right now for everyone, it is a great time to start if you haven't started. And we could even say maybe you did start right now because you're listening to all of us. And we've had some pretty cool roles, I think. And so it maybe if there's a position that we have now or that we went through that you thought was really interesting, or that you have questions about, I'm sure we'd all invite you to reach out to us, ask questions. And same thing for outside of just us as part of this group. I'm sure a lot of you are active on LinkedIn. So maybe there's someone on LinkedIn that has a position or has said something that's very compelling to you. Just feel free to reach out, with the understanding, of course, sometimes people have tons of people reaching out to them and maybe they can't get back to you right away. So just in case someone doesn't reply, that doesn't mean you should stop trying. Just keep reaching out, and I'm sure you'll make some great connections. And Carrie, I'll send it back to you.
Great. Terrific advice. Networking, networking, networking. I think many of us have examples throughout our career where networking made the difference in learning of a new opportunity or being able to take advantage of that opportunity. So terrific advice. And at least for me, I'm totally open to being contacted on LinkedIn. So feel free to reach out. All right, great. Thanks, Sarah. Dawn, for your, obviously you've had varied career roles outside of traditional clinical counseling. How did your training prepare you to be successful in each role? And maybe some examples from those. Thank you.
Yeah, absolutely. And, I kind of echo a lot of what Sarah was just talking about as well. So, after working as a prenatal genetic counselor for 2 years, I took a job with the Medical University of South Carolina in Charleston, providing telemedicine for alpha-1 antitrypsin deficiency. And at this time, the standard was still in-person genetic counseling. So telemedicine for genetic counseling was in its infancy. And it was telephone-based, right? So there was no video. And I was only 2 years into my career. So I definitely felt like this was a big jump. But what I learned pretty quickly was that all of the components of a counseling session were the same, even if we were communicating over the phone. What was surprising to me was that I felt I was able to build rapport with patients quicker because, for one, they were the ones initiating the sessions. They were the ones calling me. So they were already ready and engaged. And they were more willing then to be open and vulnerable in our sessions. Also because of that sense of anonymity that comes with not being able to see each other. We weren't sitting face to face. They didn't have to necessarily worry about running into me at the grocery store because they're calling me from all over the country. And so I felt that I was able to have deeper, more meaningful counseling sessions, which was shocking to me because, again, it was going to be telephone-based, which was very new at that time. And so some of my most rewarding counseling sessions were during this time. After that, I decided to take a risk and join a startup company, and that unfortunately folded a month after I moved my family across the country for it. So this was another huge kind of scary moment in my career, and not sure what my next options were. I was applying for genetic counseling jobs, and I wasn't lucking out that way. And so what this led me to do was to transition to industry. And so I took a job as a sales representative for one of the manufacturers of the therapy for alpha-1 that I had done some consulting work for during my time at MUSC. This is a job where I felt like a fish out of water for sure. But again, what I learned pretty quickly was that the conversations that I was having with the primary care physicians that I was calling on as a sales rep were the same conversations that I was having with patients when I was providing genetic counseling. I was using the same soft skills to build the rapport, provide information, but just to a different recipient. I was having those same conversations, taking complex genetic information and providing it into an easy to understand form for the doctors, so that then they were able to take that information and use it in their practice with their patients. In many of the cases, the providers that I would meet with were more willing to have these conversations with me compared to my counterparts because I was a genetic counselor. So they viewed me as one of their own, another healthcare provider. My experience as a sales rep then led me to be offered the role as a sales trainer. And this was an incredible growth opportunity. This is where I was able to gain firsthand experience with all aspects of corporate America, which we don't get that training in graduate school. So I collaborated with our sales leadership, with marketing, with operations, and with client services. And again, I was utilizing my genetic counseling skills in the training programs that I developed for the sales team. And so again, same conversation, same process, same taking complex information and scaling it down in easy to digest ways, but for sales representatives, so that then they can take that out to the field and have those conversations with the providers that they're calling on. And I was also able to provide that firsthand healthcare provider perspective for them that typically they weren't getting or that they didn't have as sales reps. This also provided me the opportunity to facilitate leadership training and development. And this is what did that bug in me for my leadership and leadership roles. And that is what has been integral to my success in my current role at LabCorp. I think without that, I might not have even been offered the role at LabCorp or have been able to be successful in it. So as the director of our laboratory GCs, I tap into the counseling skills I learned in grad school all day long. Even though I'm not talking to patients, I'm not talking to providers most days, but just in my role of being a leader, I'm utilizing all of those skills. So no matter what job I've done and how far it has seemed outside the box of traditional genetic counseling, I have used those skills and the knowledge from graduate school in my everyday. And that training is what foundation to be successful in any role that I choose to try. And there were definitely times where I felt, especially when I was working in sales or sales training, that I felt so far outside of the realm of what a genetic counselor is. But again, I think that training I had really anchored me to be able to be successful in any of these roles. My one piece of advice is to seize any opportunity that comes your way, right? I think you're hearing that on this webinar. If I think back to the vision of what I thought my career journey would be when I was graduating from graduate school, my path has been nothing like that journey. But at the same time, I truly believe I've incredibly rewarding journey, and I feel like I'm exactly where I need to be because I these even when they weren't part of my vision, even when I wasn't sure if
Sorry to interrupt, Dawn. I think that your audio just cut out.
Just the last sentence or two, I think we lost your sound, Dawn. But hopefully, oh, you're back.
Oh, I'm back? Okay, sorry about that. I was saying my one piece of advice is to seize any opportunity that comes your way. And that, you know, the vision that I had for what my career would be when I graduated is nothing of what my path has been. But at the same time, my path has been extremely rewarding. And I think that I'm exactly where I should be. And that's because I stepped outside my comfort zone, took leaps, took risks, and tried new things. And each step along the way opened doors that I think otherwise wouldn't have been opened or possible had I not had those other experiences.
That's great. Such an interesting set of
Chris.
experiences. Yeah, it's terrific. Thank you for sharing that, including the, you know, the good, the bad, and the ugly throughout all of our careers is important to share and be transparent about, and also highlight like what we learned from it. All right, awesome. Thank you. Jesse, so question for you. What do you think is the trajectory for genetic counselors in industry? Either, you know, maybe a reflection on where it's been, but also where it's going.
Great. I love getting to hear everyone's perspectives. I'm like nodding my head like a really good genetic counselor on a bobblehead doll, and really inspired by all your all's comments. And I think highlight really where we've come. So I wanted to just start by kind of reflecting on how we got here. So when I think back to 20 years ago, it's been a while since I graduated, you know, we were still using terms traditional and non-traditional, and there were very few opportunities, I would say, but they were exciting. I mean, I went in to be a genetic counselor because I was excited about these patient-facing roles. And I think that we've really observed such a tremendous growth since that time. And I would have lost all bets about where we would get to now. So actually that makes me excited about thinking about, you know, if I'm projecting or making predictions about what will happen in the next 20 years, I will certainly be wrong. And I'm excited about that. So I think, you know, that's largely due to the fact that genetics and genomics are just so much more integrated in all aspects of healthcare. To me, it feels like wherever there is that word, there is an opportunity for genetic counselors. And it may not seem directly obvious, you know, as the other panelists have shared, opportunities may have seemed like a stretch or really far away from where we are as genetic counselors, but those foundational skills are quite transferable into these other roles. I think it's really similar to other allied healthcare professions. If you think about nurses or other professionals, and I meet a nurse, they might say, yes, I don't know that I often hear a nurse say I'm a nurse by training, but that their background is as a nurse and then they're in some other type of a role supporting the healthcare industry. So, you know, I think we've seen a great deal of growth in roles like marketing and sales and product development, product management, market access, and we'll continue to see growth in ways that we might not have anticipated, but that all of those foundational skills are directly transferable and necessary and needed in those groups to really make sure that those products are successful or that processes really take into account the perspective and expertise that we have to offer. I will say, just thinking about my own role, or you know, how I've sort of defined myself as a laboratory genetic counselor. Like I said, I started off in patient-facing roles, and then I remember that switch. Like if I go to this lab genetic counseling role, it closed doors for me. And I would say it was quite the opposite. So echo what some of the other panelists have shared in terms of taking those risks, or what might feel like risks, and the benefit that will come from new skills that you'll build and then new doors that will open, as maybe cliche as that might sound. But that each time there's been new opportunities. So even within laboratory genetic counseling, those roles, you can't even really say, well, I work for a lab, but am I a laboratory genetic counselor? I have the privilege of being an editor on a textbook for practical genetic counseling in the laboratory. And we're doing the second edition now, 10 years later, and are adding chapters to highlight the various roles that genetic counselors can have within the lab industry. And that to me is just really exciting. It's also exciting because I think it will give tools to my new colleagues and peers in the field to be able to more directly articulate how our roles or skills can be applied, and give you those sort of really practical language, or like, how do I search for the job description where I might actually fit? That's exciting to me, that I think we can really demonstrate our value. When I think about trajectory, I think we still have, you know, there's still opportunity to continue to demonstrate why we are the best fit for roles. I've observed, you know, just challenges within my own leadership structures at various organizations about, you know, what is it that you do, or why should a genetic counselor be hired for this? And I think that that's sort of the call to action for us, is to really try and articulate this in a way that really advocates for our peers, especially given how challenging the market is right now. Because I think there's a lot of places where genetic counselors can land where there isn't genetic counselor in the job title, and that we can really have value to add. So one of the things I was reflecting on today is, you know, so I'm only a few months into my new job, and in market access, you get to interact with folks all across the company. And it's been just really rewarding to get to meet new folks, and often find out that they say, oh, I'm a genetic counselor by training. You know, my background is this, and in roles that I wouldn't have expected either. So that gives me excitement and hope for kind of what the next 20 years will look like. And I really think it's just up for us to get creative and be open to those possibilities. So I'm looking forward to more discussion with, you know, the question and answer portion, and getting to chat with the other panelists.
Great. Thanks, Jesse. Awesome answer. And yeah, I think it's the the hashtag that you'll see today a lot is I am a genetic counselor, and there's the and I do these other things. And yeah, totally hear the idea of, if I had made a bet on what I would be doing when I started grad school, I'd be completely wrong. But same when I started college, like I hadn't heard of genetic counseling when I started college. And so there's always new things being invented and new things that we're getting exposed to. Exciting. All right. So please do send in questions in the Q&A box there. We're very open to them. One of the first questions, and I'll just open it up, anyone can answer. What is something, it's a great question. What is something that you would like to see more of, or what is missing within the genetic counseling field? And I'll add to that within genetic counseling, include training in that as part of the field.
I can
I'll
say, sorry. Oh.
Go ahead, Sarah.
Okay, sorry. I was going to say more kind of organization around knowledge exchange. So you can see that we've all kind of gone down these different career paths. And, I've specialized on payer coverage. Jesse has this great just overall lab experience. But is there a way for us to either collect these expertise, whether it's subject matter experts or just the content itself? So I know we have these great, and through NSGC, SIG discussion groups, we have blogs, we have all these different avenues, but I'm wondering if there's a way for us to collect more of it and be even more organized around it.
Great answer.
I think, Dawn, that was, you and I were interrupting each other.
Yep. So I was going to say, in terms of training programs, I would love to see more information or education in the training programs, just about, well, one, around the business side of whether it's a hospital or industry companies, right? Because so much of, even within hospitals, they're a business, right? They have to make money. And so understanding those aspects, the business aspects of whatever job we're in, is having that fundamental understanding really is paramount in understanding our role and what we advocate for and how we fit into things and understanding that. So I think more education in our training programs around that. And then also with that comes education in lots of different roles, the roles that we're all talking about today, and just as showing that there's so many different types of roles and areas that genetic counselors are qualified to go into, so that for those who may be interested in maybe marketing or in sales or things like that, just teaching our skill set to be successful in those other types of roles. And we really have a unique value to provide and to add into those roles. I think it's going to broaden the horizon of what a genetic counselor is. Standing.
Any others? I'll add, this is a very specific tactical skill set, but I think that public speaking needs to be a lot more. We do a lot. We're very good at educating one-on-one small groups, but I think any opportunity to speak in front of a group, on a webinar, etc., is really good. So pushing people to develop and seek more of those opportunities would certainly be good. That was a skill set that I struggled with while I was in clinical practice and had occasional opportunities to present at a conference or things like that, but then did a lot more of it when I moved into industry roles. So I think that I could have benefited from more experience and specific training on that, not just learning on the job, so to speak. Okay, great. Thank you. Excellent question. Keep them coming. Here's a question. What specific job titles exist that genetic counselors could apply to other than our standard GC role? And I know that this is a long list, and so we're not going to be able to list it exhaustively, but maybe if we just go around and list some of our titles that we've got on our resumes as an example of the diversity of titles that exist. I can start like my non-clinical titles are clinical product manager, product director, clinical director of products, senior director of product marketing, head of product marketing, head of product management, head of product, now VP of product. If somebody else wants to list theirs. Jesse, you want to start?
Sure. Mine have actually always been sort of like laboratory genetic counselor with add-ons, but I love your answer, Carrie, because I really think it's like product management, program management, and marketing or market access. Maybe it's even going into sort of those buckets within the business and thinking about where you have interest and just trying to crosswalk those skills. I think it's, for me, when I was looking, it was really what's a company where I think there is genetics or genomics happening and what's a skill set I have to bring. And so for me, the keywords would be, payer, strategy, medical policy, billing, coding. I get that, perhaps if you're new in your career, those might be things that are more of a stretch, but I think that strategy of thinking about what is the company doing and where might your skill set align, that often the titles don't really make as much sense for how you might fill them. Go ahead, Sarah.
Yeah, I was going to say, Jesse, of course, listed all of my titles, but when I was looking for jobs at one point, I was actually looking by company and not by title. So I think Jesse alluded to this a little bit, but I was pretty sure I wanted to be at a genetic testing laboratory. So I just kept going to their job openings and looked at what was there. And again, did it sound interesting to me? And then, I applied, and that's actually how I ended up at my current job. Is I was actually looking at the company's website and I said, oh, wow, this is perfect for me. And it ended up being a perfect fit.
Great advice.
And I can jump into, I don't think I've had any titles that were genetic counselor except maybe my first job when I worked in prenatal, but I've been mostly in sales or sales training or on commercial teams. So I've been an account executive, an oncology product specialist. I've been a sales training manager. I've been, let me think here. I've been a medical science liaison. That's a good role for genetic counselors for sure within industry. My interests have, using the skills that I have and interests I have always been around education. So the part that I, was drawn to in genetic counseling was being able to explain concepts to people. And I've kind of elevated that with my position. So I've looked a lot around like education in genetics and those types of roles. And sometimes I join the organization that I think career path is so interesting. I think others have said it, like there's no way I thought I'd be doing now what I'm doing when I was going to grad school. I mean, there's so much opportunity that exists, but I feel like even within an organization, it's just talking to other people and then, finding what roles exist, what do they do, what is their skill set, and applying and moving. Like I've had, different journeys within different organizations just based on my interest and experience. So, I'll say my biggest thing is always networking and looking, what positions do you hear of other people that sound interesting? Sometimes we've done the exercise of like, what would be my perfect job, over time, what am I looking for? And then seeing where that exists. But I agree with Sarah too. Sometimes it's about the company, about the culture, about the pipeline, about what excites you, and then finding your role there.
Right.
Yeah, I'll
Dawn,
just
you can
echo all of that. I was going to say, I think less about looking at what the job title is and looking at what is the job description. Because I think, as we've heard, the list of titles that genetic counselors are qualified for is endless. And it's more of having an idea of what are you interested in, or what do you want to gain more experience doing that sounds exciting, and then reading the job descriptions and seeing. And you'll often find that what the requirements or what the job entails, the job tasks, we fit the bill, right? Like we have those skill sets. So I think it's more of
Don, you cut out again. Sorry, we lost you at the end there. But yeah, great answers, everyone. Thank you for demonstrating the point that it really is endless, and it's a matter of where there's opportunity and getting creative about how you find that. I think another good question on here is, do you have any recommendations for keeping up in the field while in between jobs?
I'm happy to.
Go ahead, Jess.
Love to jump in just because I made some transitions in the last couple of years between something I'd done for a very, very long time and then went on my own, and felt pretty worried about being disconnected, I think, from both sort of the science of genetic counseling and feeling out of touch from the field, and just wanting to maintain relevance in that way. I think we've said it a lot here, but it's building your network, reaching out to people that have a title or a role that you haven't heard about, you want to learn more about. And then the other thing that was just really, it's both bucket filling and also opened new doors I didn't expect, was connecting with some local patient advocacy groups who are involved in supporting my local rare disease community, and some legislative advocacy and work here. So I think that there's, pulling those strings will get you connected in a way that's both rewarding in the meantime, but also helps you build your network and sort of reflect on those skills so that you can highlight those as new opportunities present themselves.
Right. I'll give a plug also, honestly, for NSGC membership. I mean, it's really so valuable on so many levels because you do have access to frank education content, but also you have access to free mentoring. All of the SIGs are now free, so you can explore new areas if you're interested in looking in a role that's in industry, but in neuro or in cardio or some area that maybe you haven't practiced in clinically. You can get some of that exposure, not only to the content, but to the people who are really leaders in those areas through the SIGs. So those are, two really good resources within an SGC membership. And for me, because I've like right now I work at a company where we're not flush with genetic counselors, so my connection and exposure to genetic counseling roles is largely through NSGC, and I'm very grateful for that opportunity. Any other resources to add to the list, folks? There's another set of resource questions, like what resources have you found helpful to enhance personal and leadership development? Webinars, podcasts, authors, books, volunteer work, et cetera. I know Jesse mentioned volunteering and connecting with patient advocacy organizations, definitely a good one. Anything else, folks, to add?
Very quickly.
I like podcasts because they're shorter. Sorry.
Yeah,
I was going to say, I like podcasts because they're shorter, and sometimes I have the potential to start a book and never finish it. So, but yeah, I think podcasts are great. And if you find somebody that is inspiring and then they have a podcast, you're probably going to like a lot of their episodes. So for leadership, I would say Simon Sinek is a great resource, and he's got books, he's got TED Talks, he's got a podcast, so endless applies there.
Yep. Jesse?
Sorry for talking over you, Don. I agree with all of those things. And one of the things that I found really helpful was coaching. I think some people's organizations have that and offer that, but that wasn't something that I was as familiar with. And I'm actually pleased to see there's many genetic counselors who have gone into being in that space now too, to provide sort of career coaching or guidance. So I'd encourage people to explore that. I think the person I worked with was not a genetic counselor, and in some ways that was nice because it was a reflection that was outside of my industry and helpful. But also there's a lot to be said from just that sort of more detailed mentorship with someone who is there to offer those services. So just another suggestion.
Right. Yeah, all very good answers. And again, we'll plug for NSGC. We are developing more leadership content very explicitly for members too. Let's see. Somebody just asked who Dawn suggested for TED Talks. It was Simon Sinek. I'll just type that in here. Well-known, provides a lot of great content around leadership. All right. And we got a couple questions along the lines of, do you have suggestions for prospective genetic counselor students and the opportunities they can explore apart from being a GCA? Obviously, GCA is great, but there's only so many GCA roles. So what else could people who are looking at applying to graduate programs think about?
I worked as a research assistant before I went into GC program. And then someone in a program I just recently lectured for said that they worked at a forensic laboratory.
Interesting.
Again, I would think outside the box, right?
Yeah, I was
Yep.
I did psychosocial research, and it was at a cancer center. So I connected, like I was working for someone who, so it was a research assistant, but I was working for patients who had been diagnosed, some projects on breast cancer, prostate cancer, and talking to patients. So that was just super helpful from the perspective of what, a patient, what their family goes through. So I was working on projects, but then I found the genetic counselor that was working in the family risk assessment program, that was not, within my department, but within the organization. And I shadowed and, used that as an opportunity to talk to someone to learn what they were doing. And that helped me as I was going to graduate school.
I think anything that gets you in the ecosystem of healthcare is good. So, I mean, some of the best genetic counselors I know, their experience was working in customer support for a genetics laboratory. So they were talking to physicians and patients who were calling in with questions. And some of the questions were simple, like, I'm having trouble logging into my patient portal and need help with my password. And others were more complex, like I need to know more information about this test or that. And just that level of exposure to that ecosystem and the questions around payers and insurance and market access taught them a lot about that area of the field. So I think that is maybe something that people wouldn't necessarily think of ahead of time, but really it's just so valuable to have a deep understanding of how the healthcare system works is a good thing, especially if it's in the genomic side of things. Add that to a plug. Great. All right. So question, we're getting down to the last few minutes here, but I think this is a really good question, especially right now. In your prior experience, how have you balanced job security and the constantly changing job market around genetic counseling and genetics with your desire to apply to different and interesting jobs? Dawn, I'll start with you because you've had such an experience with that, and now working for a very large organization in LabCorp. But I think you can definitely speak to this very effectively.
Yeah, so I think some of it was where you're at in your life and what your tolerance for risk is. And so I will say that tolerance for risk has changed in my career over the last 2 decades, and where I'm at personally, right? So there's some of that. I think about that when balancing risks. I think the other thing is just if you feel you have more tolerance for risk, then also understanding, it may not work out like mine. 1 month later, we went from having 2 jobs as a family to no jobs, and that was pretty stressful. So for me, that has had an impact where I am less moving forward in my career. But that also made me have to be really open to looking out, outside the box of opportunities for a job. And that's what led me into doing sales. And I don't think that had that happened, I wouldn't have ever taken the role as a sales representative. And then that wouldn't have given me the opportunity as a sales trainer and so forth. So I'm really grateful for it now. At that time, I wasn't very grateful for that unfortunate setback in my career. But I think it's just a matter of understanding that if you're going to be a little riskier in what you're willing to try, understanding that you're going to have to be really open-minded potentially in looking at all kinds of opportunities that come your way.
I would say
Great.
too is, build your network, um, because I know I've said it over the years, like it's a small genetic counseling world, but there's a lot of changes that happen with the companies. And I've been part of startups, I've been part of larger companies, and what happens is they buy up another lab and then you combine, or sometimes a lab folds within an organization, and it's all stuff out of your control. So I've also learned to like just kind of roll with it. Like I can only control so much, right? So decisions get made at a high up level. You can't control that, but you also never want to burn bridges because things do change in this field. You'll find that, people or organizations you may have worked with or know, may work with, join another group. So it's just about building your network and talking about, I think pipeline's important. I think joining an organization or a company and understanding who are their competitors, how do they get paid for the services they provide? Do they have the ability to stay with the lights on? I mean, these are important things. And unfortunately, I've seen this evolution because I've worked for a number of labs. And again, we don't have control over it. But I think we should just be asking the right questions when you're evaluating a potential employer. I mean, sometimes I think to Dawn's point, it's like, what is your risk tolerance? And you may be in it for short term. So where they are 5, 10 years from now may not be the most important thing. You're just looking to get your foot in the door and get an experience, and they'll take it for, what it is for as long as it is. And sometimes you're looking for that next big career jump, and you want to know if there's stability within that organization. So I think asking the right questions, researching companies, talking to people, and understanding, there's the opportunity to potentially have changes that really you won't know what that impact is. But I think everything I feel like I've done is make me more and more marketable. So you just keep, doing what you can to be an asset to the company that you work for.
Yeah,
And
great
I was just
answers.
going to add
Go
to
ahead, Sarah.
always keep your resume up to date, because you never know when it's going to happen. I had a job that I thought was stable. Like I did my research, but you know what? Suddenly it wasn't. And, it was a big shock to me. My resume wasn't ready. So you never know. So I think like every 3 months, no matter what, where you are, just make sure it's up to date.
Yeah, great advice. I'll also add, get clear on what your values are. There's like very easy to do free like online values exercises that force you to kind of go through and identify what your core top 3 values are for this job search that you're in. And for some people, that's going to be like stability or security or, what that sort of thing. And for other people, that's not in their core values. And so it's just a good tool to help you clarify where that fits. Job security is really important for some folks, and for others it's not, and it's going to change over the course of your career. And so it doesn't necessarily always have to be at the top of the list, but it's okay if it is, and that changes over time. I will say, for instance, when again, the networking super important. When we started working on this webinar, one of the first things we all did was connect with each other on LinkedIn. So even though I hadn't met all the folks on this panel before, we're now all connected on LinkedIn. And that's just a good kind of habit to get into for whenever you have opportunities to connect with folks. So we're down to our last minute. I think we've addressed all the questions that have come in, and I appreciate everybody's time. And yeah, thank you so much. Definitely reach out. We are certainly open for that. And thank you to NSGC for setting this up, and enjoy Genetic Counselor Awareness Day. Spread the word.